Hello viewers, my name is Anishe Raibrown and I'm one of the volunteers at Sajen.org Inc. First of all, I hope this video finds you safe and healthy. And today I would like to talk to you guys about a few dental health care tips that are extremely necessary to keep your mouth healthy and disease-free. So let's start. First, brushing your teeth. I know most of you guys are brushing their teeth, but I also know that most of us are probably brushing their teeth once a day, hopefully twice a day. But I also know there are some people who are very meticulous with their home care and they're doing everything possible, like brushing every meal, flossing every meal. So that's great, but this message is mostly geared towards not only as a reminder of what are some of the things we can do to keep our mouth and our overall health healthy, but also for people, those of who are or us are not really doing what's necessary. So with no further ado, let's start. So first, brushing your teeth. Twice a day is of course recommended. If you are one of those people who brushes again after each meal, great. I would recommend, there are some recommendations that I would like to make, like when you buy a bristle, always get a small to medium head, bristle head, not the large, because if you have like a big bristle head, it's hard to kind of go all the way back. So you want to make sure it's either small, not like super small like a child one, but it's like a medium head. And always get like soft or extra soft or ultra soft bristle, because having a soft bristle, it will keep your it will help reduce the damages in your mouth. So I have a couple of pictures of where it should be. Like usually it's on the top or in the back where you should see it should say extra soft, ultra soft. I have actually came across where there's really no indication except it will say US, which is ultra soft. Just be mindful to get something that says that indicate that it's soft, not like hard. I have some people or some of my patients, they love using hard bristles. I guess either they weren't aware of the negative impact that may have in your enamel and your gum, or maybe they just like the feeling of that hardness in their gums or their teeth. For whatever reason, they weren't aware until I actually mentioned it to them. So always get like soft bristle, small head, and when you brush your teeth, please be super gentle. Don't be too aggressive, because that could lead to sensitivity. I'm not going to take too much time, or I'm not going to deviate from this topic and start explaining you what sensitivity and how it impacts your mouth and all this, but just be mindful that using a hard bristle could lead to sensitivity, or most likely will lead to sensitivity, because I see it all the time with my patients. So gentle brushing. 2, using fluoride toothpaste, ADA approved or accept fluoride toothpaste. Kind of like fluoride keeps your enamel nice and strong. It sort of like creates this barrier that protects your enamel from getting acid attack, which means help you prevent getting cavity. So definitely get fluoride toothpaste. I know there are a lot of people who are into fluoride free toothpaste and all this, because they have all sorts of information about harmful, if you use fluoride, or if you have too much fluoride, it's not good for you. And definitely anything too much is not good for you. Anything, like even if you take medications, if you take more than recommended amount, it's not good for you. So it's the same thing, like if you're ingesting or using too much fluoride, it's not good. But what our toothpaste have is like 0.24%, which is perfectly it's a healthier amount to consume every day, and you're not like swallowing it, you're just using it, you're spitting it, you're rinsing it, so it's perfectly fine. Again, fluoride toothpaste is recommended so you don't get cavities. So that's the idea, right? Because once you get cavities, then that could really open up this another Pandora's box kind of thing that could lead to so many other things. So definitely use fluoride toothpaste so we can prevent getting gum disease, prevent getting tooth decay. Number 3, brushing your teeth. Brushing your tongue regularly. It is extremely important to brush your tongue because you don't want to get, of course, bad breath, and second thing, that could lead to other infections, like having a lot of bacteria in your mouth could lead to a negative impact in your mouth, right? So the reason why we are doing or what we do at home every day, like brushing and flossing and mouth rinse and all this, is to kind of keep the bacteria low so you don't get other issues, so that's why we do it. So definitely make sure you brush your tongue. I use the metal one. I really feel like it's effective. For you decide which one you want to use. They do have like plastic one and I think metal one, but again, it's up to you. It's your choice which one you like. For me, as long as it's effective, that's the key here. No matter what steps you're taking, whether it's brushing or flossing or tongue brushing, everything is all comes down to how effective it is. You can do things like 100 times, and if you're not effective, it's not effective. But so you want to make sure it is effective. You rather do a few times but it's effective rather than doing 100 times and it's not effective. So I'm sure you guys got the point. Anyway, so the next very important step is flossing. Most of us don't really like to floss. I am one of the person who can totally admit that I hate flossing, even though I do floss and I do understand the importance of it. I do see the huge difference of flossing. So I would say, please floss. I know if you are a beginner flossing, you may find it extremely hard. You may see bleeding and all this, and that may discourage you to floss. But the key here is the more bleeding you see, that indicates there's something bad or things that shouldn't be in your mouth is there, and something bad is happening. So you want to make sure you do what necessary to kind of keep your mouth nice and healthy. So definitely, if you see bleeding, which means there are a lot of infection, or leading to infection, so you want, which means you have a lot of bacteria that could lead to infections. You want to make sure you eliminate as much bacteria. So what do? You floss. Effective flossing. Why is it important? Because you're removing not only you're removing like food and debris and bacteria from your teeth, but also you're removing from the sulcus, like the inside the gum. Like we all have this little space, we call it sulcus, where it's where the skin is not really attached to your tooth or the bone. So it's sort of like a free floating, like you have this space. What happens is, like, of course, bacteria gets in, and as you know, you don't need you don't need to even see a crack. Bacteria is there. Anything like air, air can pass through anything. So same as bacteria can pass through anything. So if you're not flossing effectively or not flossing at all, that means bacteria is just like sitting there and growing, and it could lead to infection like gum disease. I'm sure most of you heard about gum disease. And gum disease could lead to diabetes, hypertension, a systemic disease. So that means, if you have a gum disease and it's not treated, most likely you can lose your teeth. I hate to be very blunt, but I have seen it. I've seen it with some of my patients, and it's very hard to treat because most of us, if you do end up getting gum disease, full-blown gum disease, and you're not doing anything about it, that can, over the, I don't know, time, like months or years, I mean, not even years, I would say weeks and months, that could lead to some other issues in your body. And vice versa. If you have any issues in your body, like diabetes is like the big thing we've been seeing with our patients. It's like, if you have diabetes, most likely you're gonna have gum disease, and vice versa. And that will put you and your body in a very stressful mode where, you know, infections and bacteria are going all over the place, and you have to take medications, and you already know what, you know, where I'm going with this. But again, all this is, if I had to go everything in detail, it will be all day, so I don't want to take too much time. So let's go back to focusing on why it is extremely important to floss. So yes, you don't want to get gum disease, and if you do have gum disease, you could lose your teeth, and I've seen it with some patients. So please floss. If you don't know how, then please talk to your dental care provider, and maybe you guys can come up with some sort of routine on how to tackle that. But yes, please tackle that because it is important to floss. Next step, eating healthy. Eating healthy is, again, as you know, it is necessary and it's important because you want to make sure your body is healthy. And of course, it helps your mouth as well. Maybe you have heard about eating crunchy stuff like carrots and apples and cucumber. Definitely, not only they are good, all fruits and vegetables are great, but definitely those fruits and vegetables are also great because it kind of like cleans your mouth by activating the salivary glands that we have, one in here, two in down here, and it just kind of like when they're activated, they kind of release a lot of saliva, and it's really good for your mouth because it cleans it. It's like a natural cleanser, right? So it cleans your teeth in your mouth. So yes, you wanna eat fresh fruits and vegetables. Definitely lower if you are a heavy soda or sugary consumption kind of like person. I would say please bring it down to bring it down to like once a week. If you want to indulge in sweet and savory drinks and food, I would say please bring it down to once a week, and then slowly, like never maybe, but yes, please try to stay away from sweet foods and drinks, because again, that could lead to again not only diabetes but also cavities. And again, we are trying to focus on making your mouth and your body healthy here. So yes, no sugary fruits or vegetable or fruits or drinks. Number 6, staying away from smoking or excess alcohol use. Smoking, I mean everything like marijuana, from vaping, cigarette, everything. And as you all know, smoking and alcohol use, excess smoking and alcohol use could lead to oral cancer. And I have came across some of people who are diagnosed with cancer, and they were heavy smoker. In my 8 years in dentistry, I have referred about 10 people to go get biopsy or further treatment, and I think about out of 10, 2 of them were diagnosed with oral cancer. So I guess for me, I have experienced like firsthand, so I kind of see the need and the importance and importance of doing this, like refreshing videos and talking to my patients. So yes, please, if you are one of those people who are a smoker and heavy drinker, please bring it down a little bit. CDC does have some helpful resources. If you're in United States, you can Google CDC and you can get some help from them. If you are outside the United States, I hate to say I don't have much information for you guys, but one thing you could do is definitely Google your, government website, public health maybe, and they may have some sort of information to kind of guide you where to go. Last but not least, definitely go see your dental health provider, because they know what your mouth needs to bring your overall health to an ideal position, because that's what we are supposed to do. When we see you, not only we treat the disease, but we also see before and after, we create some sort of like a plan to help tackle the issues. Or if you don't have the issues, what can we do to keep the healthy steps, or unhealthy, we can eliminate unhealthy steps. Just provide a step to kind of, or guide to give you that optimal health. So that's what we are there. Your healthcare, your oral healthcare providers are there for. So please schedule and follow up with them. With this, I guess I'm going to conclude my video. I hope this video was helpful in refreshing your daily home care routine. I hope you learned something. I hope you'll share this video or information. You don't have to share the video. As long as you understand, you can share it with everybody you're around. So not only, again, you can bring your mouth to healthy or optimal position, but you can help other people to bring their mouth to where they should be. So it will be so we can create some sort of like high quality lifestyle for each and every individual in the community. So yeah, that's pretty much it. Thank you for your valuable time. Stay safe, healthy, and strong. Take care. Bye.